Abortion is healthcare. We've been repeating that fact, and it is a fact, on this show a lot lately, as we've shared the stories of women whose health, fertility, and lives have been threatened by abortion bans. If you're a regular viewer of the show, you know about Amanda Zurawski, who spent 3 days in the ICU after being denied care when complications in her intended pregnancy threatened her life and her health. You know about Brianna Cecil, who, after being forced to delay care and leave her home state, says she ended up in emergency surgery that cost her an ovary, a fallopian tube, and her hopes of having a large family. You know about Kelsey Norris de la Cruz, who was denied treatment for an ectopic pregnancy, which is deadly for the woman if left untreated and never results in a viable pregnancy. You know about Caitlin Cash, who was delayed life-saving postpartum care because the procedure to stop her from hemorrhaging is the same one that's used in abortions. If you've been watching this show, you know these stories and others like them. But this week, we learned about two new stories. This week, ProPublica introduced us to Amber Nicole Thurman and Candy Miller, two black mothers who were taken from their children, whose preventable deaths would not have happened if not for Georgia's draconian abortion ban. The story of these two women is crucial as we dismantle the lies of the anti-abortion movement and face the deadly reality unleashed by Donald Trump's Supreme Court. Because if you have been paying attention, you know that abortion is health care. And you know that it cannot be banned without threatening the health, well-being, fertility, and lives of women. But for black women in this country, their health and well-being is already statistically worse. Maternal mortality rates are higher, and the incidence of high-risk pregnancy is greater. And so the threat posed by an abortion ban is even more acute. The politics surrounding abortion and reproductive freedom have always played out differently in black communities. The difference is largely rooted in structural racism, which shapes major aspects of black life in America, from education and politics to the economy and health care. Black women's reproductive health cannot be divorced from these broader realities confronting black women and their families. One report found that maternal mortality rates in states with bans was significantly higher than the rest of the country among black women. Even the situation was even worse, with the black maternal mortality rate 2.6 times higher than that of white women. The response from the anti-abortion movement has been to point to church-funded crisis pregnancy centers, which use deceptive practices to lure women away from real health care providers and foster care as alternatives to abortion. But critics say these solutions are rife with hypocrisy and ignore the legacy of racism. Karen Attiah of the Washington Post wrote about the effects in Texas, arguably the epicenter of post-Roe dystopian America, just after Roe was overturned in 2022. Quote, "Indeed, white supremacy believes it is right to force birth on black women, while also being far quicker to conclude that black parents are incapable of taking care of their children. Black people are more likely to be accused of child abuse and neglect in Texas. Black children in Texas are taken away at higher rates by Child Protective Services. Black children also remain longer in the foster care system than white children. Expect all that to worsen now." Fake, pretended concern for women and babies is a foundational lie of the anti-abortion movement. But there's an even uglier version of this lie that targets black women. For years, the anti-abortion movement has specifically zeroed in on the fact that black women, who, again, are also experiencing structural racism in the medical industry and higher rates of maternal mortality and pregnancy risk factors, tend to also have higher abortion rates. And instead of advocating any policy that might help black women live safer and healthier lives, the anti-abortion movement has twisted higher abortion rates among black women for use in cynical and manipulative slogans in their campaign to deny black women ownership over their own bodies. You see, they say, as a rallying cry, that abortion is black genocide. This is a piece of racist, paternalistic propaganda that has been seized on by the broader anti-abortion movement in recent years, but it goes back decades to the 1960s, before Roe was even decided, when many black people rightly distrusted the government including the government's taxpayer-funded birth control clinics, which were viewed by the Black Power movement as part of a conspiracy to lower the black birth rate and limit black political power. This ideological battle over black women's bodies played out against a backdrop where black and poor women were being disproportionately harmed and killed by anti-abortion laws. A study based in New York City in the 1960s found that 80% of the deaths caused by septic abortions, a serious infection of the uterus following an abortion or miscarriage, involved black and Puerto Rican women. In Georgia, between 1965 and 1967, the black maternal death rate was 14 times that of white women. Writing for The New Yorker, renowned historian and activist Keeanga Yamahtta Taylor notes, quote, during this period, nurses reported that sticks, rocks, chopsticks, ballpoint pens, coat hangers, or knitting needles were administered to terminate pregnancies. For these women, access to abortion was not abstract. It was a matter of life and death. It still is a matter of life and death. And in black communities, women are once again resisting this paternalistic rhetoric, including reproductive justice attorney Sharissa Dobbins, who in a powerful rebuttal argues, quote, condemning black women that chose abortion helps all of these actors avoid taking any responsibility for the toxic environment that black mothers must choose to deliver their infants into. Denouncing and attempting to deny us our agency will only slow the liberation of all of us. We are not, nor have we ever been, mere vessels to birth your revolutionaries. We are the revolution.